Growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, Dr. Steve Rasner here, and I'm still here doing these podcasts. The good news is I'm starting to get weekly emails from you. So you're listening to me and letting me know that you're actually listening to me. So keep them coming. Include in those emails, and my email is my name, drrasner@aol.com. I know, I'm an old school guy. Man, I'm going to tell you something. The reason you need to listen to me is this goes so stinking fast, this being your career, that you need to get it right as you can get it the first time, and not start getting it right when you're 48 or 58. And I didn't always do those things, but I'm just saying, I just said I'm old school. Man, I'm telling you something, I don't know how I got here. It went so fast for me. And I'm, nowhere near ready to be done, but so here we are this week. And I like that beer concept I did last week, like we're out for work. And I know by now you get it. I know you know that I'm just going through these. And look, I'm doing what I'm doing with you right now. I'm hoping some of you write to me and maybe take some of the courses I offer. I hope you keep sharing your lovely thoughts, whether you're from Portugal or Ohio in the United States, or Morocco, and all these places that inspire me, I guess, to keep doing this. I don't know what podcast we're going to call this. You obviously must understand I have these a few weeks ahead of time. I think this would be podcast 10 or 11, but if Beth pipes in her voice, it means I messed it up. It doesn't matter. I'm getting into it. This is my second one I'm doing after work. Those of you that can see me tonight will see that my Christmas decorations are still up in mid-January. And I'm prepared for tonight. I have my water spray in case my cats try to get on the video. I even have a second computer up for notes, so I don't have to do all this from memory. So you didn't tune in tonight to hear me babble about nothing. Let's go back to where we were last week and pretend we're out for a different evening, or it's the same night, and we're just shooting the you-know-what. And you know that I've got this pretty successful practice. You heard about me. And I'm just telling you all the things I think that matter. So let me break that down for a second. So far this week, and we're in the real life of early January. By the way, I did over $100,000 collection the first week of January on 3 days, with Wednesday, Thursday, and Friday. Now listen, man, you get to know me, you will know that there's nothing about me that thinks that is just the only thing that's important. Because those numbers even blow my mind. And you need to know that the very following week, the week after the first one, which I had 4 days to put it together, I didn't collect half of that, which is also very unusual. It's not that unusual that I collect 6 digits on 4 days. But there are weeks where, you know what I always say? If you said to me, what does it really take to make this, to produce those kind of numbers? I say it takes 3 things. It takes new patients, and certainly we'll dedicate several episodes to marketing in 2019. It takes new patients with need, right? I mean, don't you have weeks like I do when a patient comes in and they just don't need anything? And you certainly aren't going to start switching out old fillings to make them look better. You can never cross the ethical line even once, because then you are what you are, and you know what I mean. And I've never done that. I've never, on the worst week of my worst year, it is what it is. And that's to be your attitude. You do and prepare, and you give it everything you have. You can't take off, man, one day. I'm there 4 days a week, like lots of you. You got to give it 4 days, and you got to go in and not feel sorry for yourself and do everything that I am telling you to do, even if it fails in the beginning. And mine fails sometimes. I called my office about a week before Christmas this year, and I called it 7 minutes to the hour, and nobody answered the phone. So it was like 7 minutes to 9. No one. I went to voicemail. I went ballistic when I got there. Are you kidding me? Are you kidding me? We can't show up for work 30 minutes before with my kind of organization and be ready? Is that how sports teams work? Is that how they work over in Europe? You guys tuning in from France and Germany? Is that what your soccer teams do? They don't do that in the United States either. You get there early to prepare for that game. And that's, to some extent, what it is. So I'll be talking a little bit about that in a couple minutes. But I told you those numbers a minute ago, because if you think those numbers, or me doing well over 4 million a year, the highest I think I ever did was 5, and we've hovered in around somewhere between 4.4 and 4.6. And I don't really care, by the way, what your numbers are, because it's really about what you keep. So overhead's got a whole lot to do with this. But I know those numbers blow some of your minds, and that's, even my mind, it does. So that's why I'm, bringing it up. But if you think that's just about being a good clinician, hell to the no, it's not just about that. Not a little bit. There are clinicians listening to this right now that could blow me out of the water with your skill sets that may never achieve long-term financial success because you're missing so many other ingredients, not the least of which is the fortitude that you need in this profession. Don't you let anybody tell you that this is an easy job you chose. It is doable, and you can make significant income and have a lovely, lovely life. I mean, if you put all the elements in the right parameters. I don't even know if that's the right sentence, but and so let's talk about a few of what I will call tonight the invisible practice builders. And you better believe the first one I'm going to talk about is how you start your day. So this is how I start my day. I pay my team 30 minutes to be there 30 minutes before I'm there. So let me break that down for you. Absolutely, you must have somebody. Now, my office, we're 9 to 5. That means somebody's there at 8:30 in the morning. And I don't even know if that's enough. But, there's compromises to make in life. And if I was starting out brand new, it might be 8 o'clock. And I know some of you like to start at 6. And that, that's obviously an individual decision. I don't care what time you start. You got to have the team there 30 minutes before for a lot of important reasons. The first thing you do, I'm not kidding. I know this sounds incredibly mundane, is you check that damn voice machine to see if anybody canceled. You and I have the exact same hours in a day. How you spend your days and how I may spend my days are two different things. I don't know. I'm just telling you, having a broken appointment to start my day just won't fly with me. And it's almost never a situation in my office, including my hygiene schedule, which I'll get to in just a second. So I want my clinical team there 30 minutes before. I want my front desk team there 30 minutes before, checking the messages. Maybe nobody broke. That would be wonderful. I went to hygiene department there 30 minutes before. Let me break them all down. My clinical team is going over the entire schedule for me. So they are looking at the following. They're literally looking. Now, a lot of my work I believe in comprehensive treatment planning. So, we obviously had several podcasts on that, and I'm not nearly finished with it. But that means that most of my patients, all of my patients, have some type of treatment plan. And some of those treatment plans go on for 6 months to a year, especially if they involve implants. So I lose track, especially because another majority of these patients are sedated. So a lot of times there's not a lot of active conversation going on in the rooms, which isn't the worst thing in the world, by the way. I protect myself, and I'm trying to protect you as well. And part of it, this is a long career, man. And creating an atmosphere and how you work each day. How would I work each day? I walk in mostly to sedated patients on the sedation cocktail I've talked about over and over again. Go back to the podcast or write me at Dr. Rasner at AOL, DRRASNER at AOL. By the way, keep leaving nice Google reviews, and I'll keep doing these, or send me emails. And tell your friends. I'm figuring out where the world is by the map, by the way. There's a site I go to that tells me what country downloaded me or whatever. Maybe I'll get tired of it, but right now I'm not. So part of you having maybe a longer career, or one you don't get burned out on, is one where you do what I do. You walk into dark rooms. My operatories are literally dark. I use the loops on my head. I have cool music playing. I don't hear ooh, ah, ooh, or see bodily reactions that I know you don't see 90% of the time, but to the anesthetic being given or practically anything else. If you really haven't looked into the oral sedation cocktail that I've recommended, and I personally have used for 22 years, you really need to go back to that podcast or write to me, because it just paves the way for everything. It paves the way for the type of practice you have. And it honestly, the bottom line is it's just less stressful. So going back to how this impacts my day, I lose touch often where these cases are at. Also because it is a very heavy surgical practice, and which is why I encourage you to take up surgery. And, I need to know where I'm at and what's going on next. And this is all done by my dental assistants who are going through the charts. What's the next visit? Part of, I think, having a relationship-based practice, which is what I'm going to get you to strive for, are little things like walking the patient up to the front of the desk. I know they're coming out of sedation, but, they're certainly conscious and get it. And having somebody walk them up or tell their driver what the next appointment's going to be, or telling them what it's going to be. These are all little comforting things to patients, especially those that have made a giant commitment to you. And you have that responsibility when it goes on for 6 months and a year to let patients know where are they at in the case. So that's what the assistants are doing. They're also doing something I call, will this day work? Your schedule tomorrow is made up by people over the last 6 weeks, is it not? And sometimes, and we all know this, we go into a schedule that we just can't handle. We know that we're going to run behind. So one of the things I've really ingrained into my team is looking at the patient's schedule that day and asking ourselves, will this work? And I'm sure it's not a good idea to get in the habit of changing patients' times every single day. You can't do that. But if you really know on a given Wednesday that you don't have a shot at being ready for the 2 o'clock patient, who, by the way, is coming from an hour away, then wouldn't it be better to call them at 9 in the morning, tell them, look, it's our protocol to look at our schedule each day, and we're afraid we may not be right on time at 2 o'clock. Would 2:30 work for you? We know you take off for this day because we don't want to inconvenience you any more than we have to. And look, if you say things the right way and you say it with sincerity, I haven't run into a lot of problems doing this. Okay, so that's my clinical staff, meaning my dental assistants. And when I walk into, I'll get to that. Well, let me continue that thought. When I get into the room to do whatever I'm going to do, there was a protocol I wrote in my book called the Protocol Book, which you can look up on RasnerInstitute.com. It's the first book I ever wrote. Many of you I know have it, and it's called the Ready to Work Protocol. The Ready to Work Protocol. I want to read it to you real quick. It says this. The following requisites are necessary prior to beginning treatment. The patient chart is open to the last treatment rendered, which of course could be your computer today. Radiographs are on the view box, all supplies stocked and available. This includes all ancillary supplies germane to that specific procedure, whether it's photography, for aesthetic cases, regenerative supplies for perio, all equipment, handpieces, suction lines, stools are checked for working order. And I have a rationale for all my protocols, and this one says this. Look, you're not going to go under if you have to retrieve a different doctor's stool or change the bulb for the operatory light. You're not guaranteed a bad day if the suction lines are clogged. It's just negative momentum. The Ready to Work protocol is just a microcosm of the bigger philosophy that says it's hard enough dealing with the big things you can't control, like a recession, an economy, or a lost employee due to the transfer of their spouse's job. So control what you can control in your own little kingdom you call your office. I don't know if that resonates with any of you, but I'm telling you, the biggest one for me, I don't even know how many hand pieces I have. But when I sit down, I know it's not a big thing. I want my handpiece to not be the one of the 12 I have. That always seems to be the first one I use on a given day. That has needs a new turbine, where the drill won't rotate. Little things like that. So that's called the Ready to Work protocol. And there's many I'll give you over these podcasts that I think are pretty cool out of the book. And how that book came about, if I haven't told you yet, is I got tired after 20 years of not knowing what I wanted to do when. In other words, what to do when. My hygiene patient's out of town and she's 20 minutes late. Doctor, what should I do? You know, you're going to see them in my office, by the way, if that's the case. And we have ways around everything. But I tracked for about a year and a half everything that happened that I didn't like. And I literally wrote it down the moment it happened. So that's where my protocol book came from. And you can have your own. Don't even buy mine. Start your own protocol book. I never knew that mine would become a thing. Another thing, this is very important, the hygiene protocol for starting a day. So everybody listen for a minute. We all do scaling and root planings, right? But what happens after a year or two to lots of these patients? What happens is that once in a while, your hygienist will come into your room and say, you know, we scaled and root planed Sally 2 years ago, and her gums don't look that good. And I told her, if they don't improve, we're going to have to scale her and root plane her next time. You know, is that what physicians do, guys? I'm asking you. I mean, be a doctor. So here's that protocol. My hygienists are expected, actually, not the day they're working. They're expected to do it the day before, to look at their schedule. And anybody with a history of scaling and root planing, over 2 years old, I want them flagged for the next day. I want you to take that to the insurance department that day, the day before the schedule, and find out what their coverage is in the event that they need it. Now, I am in no way, and if you don't think anything other, you don't know me, suggesting that you look for scaling and root planing. I am simply saying, be a doctor. When you go into the hygiene, when the hygienists go in for a recall patient, it is what it is. Is it puffy, edematous, purplish, bleeding, and you're just going to wait and give them a warning? There's studies on this. The statistics are staggering how many patients do not maintain or are not compliant with what is required, not the least of which is dental flossing, to maintain themselves after perioscaling and root planing. And so what you're doing is watchful neglect. What you're doing is not adding services that are actually required medically. And by the way, I have a brand new form that I got from an amazing periodontist, Tom McCartney, in Florida, in Fort Lauderdale, Macaulay. And you should ask me for the form, and I can have it emailed to you that connects all the suspected systemic problems that are associated with periodontal disease. It has like a human body with branches off of it, talking about everything from diabetes to cardiovascular issues and a lot of things that many of you already know. Tom, if I butchered your name, forgive me. I'll correct it on my next podcast. So that's what's going on. And the reason that they give it to insurance the day before is because if you go in and you need to have what I call RAP. I have a lot of RAPs, RAPSs, what to say when actually. So I've taught my hygienist, look, a lot of us were just people, right? So it feels weird or awkward. And in the patient's mind, it never was 2 years ago, was it? When they were scaled and root planed. Wasn't it like 1 year ago? Well, most insurance companies, if that's the problem, will cover it within 2 years and at least have some kind of soft tissue protocol for your patients with a history of root planing and scaling. And if you take forever, 30 minutes, to figure out their coverage that morning, then you're never going to get started or be productive that day. So if you want, I have all this stuff in writing. All you got to do is ask me for the hygiene protocol for the morning meetings. The next thing I'm going to talk about that needs to happen in the morning meeting, so far, just to summarize, your clinic part of your office did what they were going to do. Your front desk office checked the voice messaging to be right on cancellations in case that was an issue. And while we're at it, how do you handle the patient that says to you, I would like to have the first hygiene appointment of the day, the first week of March, or whatever month they say? The answer is they only get it. This is called the opening appointment protocol. They only get it if they've never broken an appointment. Now, those of you in practice for under a year, you're going to have to figure it out the hard way. But I will tell you this. Why is that important? Why would I make such a protocol? There's several reasons why. Number one, go back and look. Your hygiene department is the most predictable, profitable center you have. I didn't say it was the most profitable. It's the most predictably profitable. Meaning, if you put a body in the chair, there's no way your office will lose money in a given hour. Now, why is that? It's because none of us track, because nobody has to redo it. That's why. The shade is never off. So think about all your other crown and bridge, your implant, your restorative procedures. You know, every time something doesn't go right, that cuts into your profitability. Hygiene is the only department where that does not factor in. I mean, how many times in your career has somebody gotten out of the hygiene chair and said, well, I like to do it over again. I'd like you to do it over again. I don't think it was good enough. I mean, that almost never happens. So you cannot afford to waste a broken appointment, especially the opening appointment, because you can't fix the opening appointment. You get there at 8 o'clock, and does it send steam through your blood when the hygienist is sitting there not with a patient, and your office convinces you that they fixed it because they moved the 9 o'clock patient up, when in reality, you lost the 8 o'clock patient, because the 9 o'clock patient gets there at best at 8:45. So no, you didn't fix it. And if if it was at 11 or 12 or 1 o'clock break, at least you have a little time to fix it. And one more thing that I've noticed from 38 years of this. People that break one appointment, they'll always break a second appointment. It's just the way it is. Even if it's a good reason, they will break a second appointment. Just like that employee that you have that calls out sick way more than the others, which I never would tolerate, by the way. I actually bring it up. And I don't want you to think I'm a dictator here. I'm running a business. And guess what, folks? Those of you listening, which I hope you are, that aren't the doctors, when you're not here, everybody's job just got a little bit harder. So when you don't show up on Monday after the long weekend of a Friday, Saturday, and Sunday, I understand sometimes people get sick. I get it. But it's not because you have a little sniffle. It's not because you got to take somebody to the doctor's office. We're running a people business, and we need our people there to conduct business. Okay, I'm at 25 minutes at this point. So the last thing I want to talk about today are the little balances. So this is another thing I instituted many years ago, and it goes like this. Before your next business day, now if you haven't implemented this, it's going to take you a week or so to get it together. What you do is you put your insurance department or your billing department in charge and make sure that every patient on that schedule every day that has a balance that is verified and proven. It's literally written in our schedules so that it's asked for and collected. Here's the point. When you don't collect those little balances, and I mean, say the patient's bill was $4,500 and they only owe $120 now. Guess who didn't get paid? The doc didn't get paid. The labs, the electric, the staff, the supplies, they got paid. The last money that didn't get paid is 100% the doctors. You want to get on good terms with the doc? You're looking for really a legitimate raise on something you've brought to the table? Collect the little balances that are due. I don't care if it's $19 or $219, it's due. And here's the thing. 90% of your patients are not going to say, oh, that's great. I was hoping to pay more money this morning. No, they're going to say, how did that happen? And there is a myriad of reasons. It'll be the subject of an entire podcast on having clean database. Do you understand that if the Social Security is off, the address is off, the group number, there's a million things that insurance companies teach their employees to look for to deny your claim. And if it's denied long enough, that would be a year, they don't have to pay it. I don't know how that became a law or even fair, but it's not. So we'll talk about clean databases on another day, or write to me on any of these things. I have an amazing assistant in Beth Hoffman, and she, as many of you know, gets everything out to you pretty much the next day. So start having a protocol where, so the answer would be, going back to it, when the patient says, well, how did that happen? Your front desk staff member has to have a clear, verifiable answer. Oh, I'm not even allowed to give you that balance, Mrs. Green, unless it's been verified. Here's how it happened. It got kicked down from a service that we submitted for by your insurance company, which they can do, to a lesser fee, and it left you with a balance of blah, 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 or whatever reason it would be. By the way, one more thing before I go. This is one of the reasons I honestly implemented getting paid up front, because it cuts down on broken appointments. It's night and day when you owe the patient. I know from the sound of some of these principles I'm sharing with you that it sounds like, oh, I care about his money, and it couldn't be further from the truth. I give an amazing service, and I know you do too. You should not feel embarrassed that you need to be paid for that. There are clinics, there are places patients can go for free, if that's not many. But if you're a private business, then you need not apologize. And you, in fact, owe it to yourself, your team, your staff, your family, to run a tight ship, which includes getting paid the services for the services that you supply. Well, this wasn't the sexiest video I've ever done. I hope it helps some of you today. I have a lot of material more to give, and I didn't get to any of it, not nearly enough of it today. Coming up in some next videos, podcasts, we'll talk about 10 things we never say on the phone. We'll talk about, I know we goofed, how to do, well, sometimes you goof. Vacation protocols. In my office, anybody can take a vacation anytime they want, as long as they arrange the coverage. It's not my job. I know that sounds totalitarian. I am telling you, it's how I've done it for 30 years, 38 years. Sometimes it's a problem, but when a hygienist, sometimes it's just switching jobs within the office and not getting an outside temp agency involved. But I got a lot of good stuff to share with you. I hope it's helping some of you. Stay with me. Tell your friends. And I'll see you on the Lionhearted.